Hey there, let's talk about HPV. Let's spread the word, not the virus. The HPV vaccine, it isn't just for girls. Spread the word about what HPV is. HPV stands for human papillomavirus. We usually hear about females needing to be protected against the HPV virus, but what about males? Males actually have higher rates of some HPV infections than women do. The virus is the most common sexually transmitted disease in the U.S., with at least 80% of the sexually active population having HPV at some point. Many people don't even know that they've had it. The virus infects the anus, rectum, throat, or mouth. It's passed from person to person through sexual contact. This includes oral, vaginal, and anal sex, and condoms just aren't entirely effective. There are 150 strains or types of the virus, with 40 of those strains or types that cause the HPV disease, which can lead to genital warts, lesions, and even cancer. Spread the word about cancer from HPV. A full 4 out of 10 HPV-related cancers are in men. Upwards of 14,000 men get some form of HPV-linked cancer each year, mostly from oral cancers. That is more men than can fit in the average-sized college basketball field house. At least 60% of penile cancer is linked to HPV infections. At least 70% of oral cancers are linked to HPV infections, which is higher than oral cancers caused by smoking and tobacco. And a full 90% of anal cancers are linked to HPV infections. It is believed that HPV is the primary cause for all 3 of these cancers. These HPV-linked cancers lead to approximately 9,000 men dying each year. That's pretty scary, guys. Spread the word about the HPV vaccine. There is no cure for the virus, however, there is a vaccine. The 3-dose HPV vaccine is recommended for both males and females age 11 to 26, since that covers the age when sexual activity first begins, but it can be given as early as 9 years old and as late as up to 45 years old. The United States has recently begun recommending that males get the vaccine on the same schedule as females, but only about 6% of males are being vaccinated for HPV. The benefits from the HPV vaccine are clear. Vaccination leads to an 86% reduction in HPV infection and a 90% reduction in new genital sores. The vaccine prevents both the warts, lesions, and the cancer. Getting the vaccine not only protects you, it also protects your partners. You're more likely to get attacked by a snake, bear, or shark than to have a bad reaction to the HPV vaccine. To me, 3 shots is way better than facing surgery, chemotherapy, radiation treatment, or even death. Spread the word about how to get the vaccine. You can get the vaccine at your local doctor's office, pharmacies such as Walgreens, the county health department, Planned Parenthood, or even your Syracuse Health Center on WMU's main campus. There's many ways to pay for the vaccine, such as private health insurance, Medicaid, or out-of-pocket, and there's 3 assistance programs that make it free: the Michigan Adult Vaccination Program, Vaccine for Children's Program, and the Merck Helps Program, which is a manufacturer's program. Spread the word about where to find out more information about HPV. Check out the websites listed below for more information. Thank you for listening, and remember to spread the word about HPV.